Now let's stop people from using substances. The opioid epidemic, I'd like to point out, really was stimulated by the pharmaceutical companies. That the overuse of prescription drugs is what really got that off and running. But we've had other substance problems. We have stimulant problems. Cocaine and methamphetamine. And what we find is that trauma, genetic predisposition, and mental health are the three most contributors to people using substances. So those are the three areas that we want to focus on in order to make a difference. Part of our issue is, how do you measure that? How do you measure that you've had an impact, except no deaths, right? Or lower substance use, because prevention is always tricky. If you prevented something, there's nothing to measure, right? Because it didn't happen. But the number of people we can reach, the number of kids we can reach, the number of parents we can reach in helping them understand the disease, then we've made a difference. Is that, did I answer your question? That was a long-winded answer.
Yeah, and just one follow-up before I have Mike talk. So are there any other agencies that you could, that you would like to see more help from, that we could reach out to that might be able to help prevent?
Well, I work with a lot of agencies. There are a lot of agencies doing a lot of really good work all over the county. And I in no way would ever think that my work is what makes all of this happen.
So what agencies, what are some of the agencies that could use more help from us to do a better job or to do a more complete job?
I can't answer that for you. What I can tell you is there are agencies that specialize in treatment. There are agencies, most agencies specialize in treatment in our community. There are very few prevention programs. Most of those, the funding went away for prevention programs. So anything that if the schools need support, providing services to students on site, that is really valuable. Supporting social workers and clinicians in the schools or for that population is really important. We want to get people before they need treatment, if at all possible. So anything that's school-based or education-based I would recommend that those are good investments. We work across the board. There's a couple of, the sheriff has a coalition, the Substance Use Prevention Coalition, where his focus is on kids. So they do a lot of public education, billboards, and mass communication. There is a program where they have people, some of the police officers going into the schools. Some of the schools have specific curriculums, and some of the police officers go into the school to do that. There are evidence-based strategies that are available to these types of prevention programs to be able to use. That's one we have. Braidwood has another one. They have a coalition and they work to do the same thing. Wilmington has one. So we might look at supporting those community-based coalitions who know their community really well, and they know what triggers some of every community isn't the same. Joliet's not the same as Wilmington or Braidwood. And so it takes local strategies in order to do that.
Maybe we can teach kids how to have fun straight.
Well, and I do want to, you're never going to teach kids how to have fun that we think the way they should have fun. I got to tell you that. My experience with kids have been, think about what it was like when we were kids and what it's like today. It's very different. And I have to keep saying it's okay. It's my age showing. Kids aren't using to get to party. It's not, I don't like to categorize it that way. Kids are using because they're in pain and they're trying to minimize the pain. So if we keep it thinking of that way, as opposed to this is a party drug, we'll get more at what's causing the pain. What are they trying to not feel, and help them deal with that and feel that, as opposed to, we remember the 60s and the 70s, right? When it was looked at like everybody was getting high to get to party. it's different now. The reason people are using is different. I'm sure it was the same, but it's a different genre right now. It's a different, so.
Thank you. Michael, I had some questions or?
I do have questions. I was gonna say congratulations, and I always feel weird about saying congratulations, only,
No, we're making a difference. That's.
I know,
thank you.
it's the
Thank you.
difference, but to go from 111 deaths down to 58 for overdoses, that is a big improvement. But in your report, you had something about a Tenuvin 700.
A new drug.
It is the new drug its
770.
acronym is BTMPS,
Right,
which I will
right.
not remember if I had not written it down. What are the effects of this? I mean, it's plastics, right?
Yeah.
And are they what is the effect of a plastic in a drug?
Okay.
And
It's a
and
filler.
why is this a concern?
It's a filler. So what we're finding is that many of the additional substances they're adding are fillers to make them bigger. Fentanyl was added because it was a filler to heroin, right? And now you have xylazine, which is added because it adds to, it's cheaper. You can purchase it cheaper. It's easier to get. So some of these substances people can get easier. Since China, they've cracked down in China about some of the types of things that they were shipping to us. It has nothing to do with what impact it's going to have on the drug. It has to do with what they can fill the drug with. A lot of what we're seeing, and we're not seeing those plastics things around our community so much, are anesthetics. So any other type of anesthetic that creates kind of a sedative type of effect, that's being mixed with the drugs. Those are what we consider really dangerous because when there's an overdose, we don't quite know what the person is responding to. Are they responding to the sedation? Are they responding to the opioid? Because they look similar, but you don't treat them the same way. So those are the ones that we are concerned about. But if you think about what they put in methamphetamine, I mean, there's rat poisoning. It's like awful. And so these are not chemists. In fact, I was just reading an article over the weekend in the paper about what goes on in Mexico when they're creating new combinations. And they test it on the citizens. They go and they do hot shots. And if the person passes out or dies, it's a good hot shot. They put it on the market because it's what they want. And the belief is there's always somebody behind them who needs it. So they really don't look at death as a negative. They just look at death as it's a strong drug. And therefore, there's people looking for strong drugs. There is no good therapeutic use or thinking going into this. Does that make sense?
Okay. Yes, I was just curious because it was like
Oh, I can't tell you what got
the
in what.
plastic part just
concept.
kind of baffled me. And
The
I was
chemical
hoping
must
that our
be
bodies
readily
would be
available.
smart enough to just flush the plastic out. But I thought, are we absorbing some of it? Is it, risk of cancers and all this other stuff? But
And in
Um,
reality, Micah, there are a lot of those substances in many things that we eat and drink
That is-
so we don't have a
there's
clean
plastics in
supply
our
either.
lots of things, yes. My next question is the Cass Street Bridge. You had mentioned that there was
I'm sorry, I didn't hear
the
what you said.
Cass Street Bridge.
Oh,
There
yes,
were a
yes.
couple of overdose deaths around that area. And you had mentioned that there were steps being taken. What exactly were those steps?
Well, we go to the area and we make sure they have Narcan. So when we hear, we try in the homeless encampments, we always try and make sure that there's Narcan and there's services that we provide. I don't necessarily send my staff in, but we know staff who do that through who go in regularly and provide that, and they're trusted. So we make sure that we have Narcan.
That's what I thought, but I just wanted to be sure, especially since, the
No,
recent.
that's a
deaths
hot
there.
spot under the bridge.
The Recovery Community Center of Joliet, the RCCJ.
Yeah.
So they are open and operating. And they are offering a lot of services. Can you kind of give me a highlight of this? 'Cause
Well,
I was not available for the first opening, and so I know there's
And actually,
another one
there's going to be
coming
an
up in
open house
January.
and a bigger one because it was just a soft rollout that they did. The in reality, the three things that they focus on is they do have a shower and clothing closet for people who need that service. It's not every day. The shower is available, I think, twice a week. And the clothing is available so that people can get jobs, so that they have the opportunity. We also have have computers there for people to assist in applying for jobs and having access to the internet and having access to workforce services kind of opportunities. And then the third the one that's going now is it's a location for people to have their AA groups, their NA groups, and the location for people to gather. So it's a landing spot. What's it being developed is the peer support services. So having somebody there to help people if they need a warm handoff into crisis. What an RCO, an RCCJ functions most as is connecting people to other people who've been in the same situation, who may be able to help them in their journey to either recovery or family issues or other issues. And the folks who are volunteering, we only have one, they only have one staff member. They volunteer and help them with that. There are, it sounds like a lot. It's not, they're open 8 hours a day and they're doing a lot for just a startup. So they've been very successful. Christmas time, they did a coat drive, they did food drive. So they do community events, community supports. If they find out something's needed, then they rally and they do it.
So their showers, do they need like gently used towels and
Yes.
washcloths
Yeah.
or anything that we could like go through our cabinets and do a January clean on?
Yes,
Okay.
yes. Anything like that would be very appreciative.
Wonderful.
Just
then-
that, and in regard to that, just to give you also a heads up, the other thing that we found out is our shelters in town don't have blankets. And so if they have sheets, but not a lot of blankets. So I'm trying to get the word out that if
That's
you have
like
blankets.
Morning Star?
Yeah, and Daybreak. Daybreak was the one.
Daybreak.
So if you feel so inclined, they could really use blankets.
Thank you for that. And then on a high note, please I think it's Xenia Garrity,
Yeah. Oh, Xenia.
Xenia,
Yeah.
I knew I was going to butcher that one. Please tell her I look forward to meeting her. She is the new substance use treatment programs peer recovery support specialist, because that's not a mouthful, but I do look forward to meeting her.
We are very proud that she has joined us. It's this is our formal peer support program in the health department. And she's very successful. She's busy. And this was a new program. It was helping mental health services and substance use services know to make those referrals, and also helping people understand what does a person like this bring to the table if they're not a clinician, right? Well, it turns out they bring a lot to the table and they're very helpful. And so, and Xenia is more senior. We happen to be lucky. She has her CADC also, so has a bit of more knowledge, and she's building that program well. So we hope to see that expand in the future too.
Thank you. As all my questions, you're off the hook with me. Thank you.
Thank you. Thank you, Mike.
Julie.
Thank you. So Kathleen, could you provide us with a list and the organizations that you mentioned of the things they need, and then we can go forward from there
When
to
you say that, you mean,
the blank, you mentioned
oh, like the
blankets,
blankets, I can
towels.
send a
yeah.
note to.
yeah.
So-
And for, as far as bedding is concerned, like blankets, they have to be new, correct? Because I know when we did a collection in the fall and they absolutely could not take used sheets or blankets. So we need to know that,
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 we've given them
yeah,
used
just,
blankets.
just to
Well, I'll
have,
give you the information that I
Yeah.
have. So I
Okay.
don't want people giving things and then
that
say,
would
no,
be
we can't
great.
take that.
Thank you.
But it was amazing to me that a shelter didn't have enough blankets. But what happens is when people leave, they take the blankets. So it's a constant turnover. It makes sense, right? So, yeah.
So in reading some of the agenda items from the minute, I was very interested in the maternal morbidity and mortality maps that were in the minutes. So is it possible for you to provide us with a copy of that? Because it's not in the materials? It's written in the minutes.
So I'm not quite sure what you're referring to, but
It's on page 3 in the agenda item, and
which
I'll show you.
I know what the program is. I can talk to you about that.
Yeah. Yes, it's in the health department, so maybe we should tell Elizabeth about that.
Actually, it's my
Um,
program, so I can tell you
That's
about
what
it.
I
So,
thought. Okay.
I shouldn't say it's my
If you
program.
have an actual map though, could
What
you?
map? And that's what I
It-
don't refer.
It's on page 3. It says, let me try to pull it up.
There is a
again.
report that in research that talks about maternal, child and substance use, which we are basing the reason for our creating this new committee to address substance use and maternal
Mhm.
care. And so the committee has started. We're funded by the Illinois Public Health Department to put together harm reduction kits. What those kits are actually, they look really nice. They're like makeup bags that we're getting together, and we're putting Narcan in it. We're putting test strips in it. We're putting KY jelly. We're putting condoms, and we're also putting personal care, cream for pregnant women. And we will also be providing them with information and understanding of the dangers of using substances while they're pregnant. What happens is that women are afraid to get care during their pregnancy because they're afraid their kids are going to be taken. So what we're trying to do is reduce that fear, make it a safe place, and be non-stigmatizing for women, right? There's no judgment here. There is just care being provided. So that's what we're trying to do across a couple different departments, women's health, the health center. Is that what you're referring to?
Yes, and I'd love that information that was presented at that meeting.
Okay.
So that was last month's meeting. Then I have a couple questions regarding the opiate overdoses and Narcan. Is every overdose reported to the county?
The deaths that happen in the county
Mhm.
are reported to the county.
And so every incident, whether it's at a hospital or on the street, is the county notified that an overdose occurred?
A death comes to the coroner.
A death, but
Yeah.
not an overdose that's revived.
There are a couple different databases for overdoses. Hospitals have their own database, and they report that to the Illinois Public Health Department. I get that information a year or two later.
Okay, so we don't get it from the hospitals.
No, I
Okay.
would like, I know that the state is working on merging our databases so that we get it quicker.
Mhm.
The information that comes to me is people who've revived somebody and they do the form, and we put that information into the statewide portal. So anyone who's gotten Narcan from me and they report it, we report that through our database. And then there's OD Maps, which is another database that the DEA has created that also has overdoses reported through that. So we are not a coordinated system at all.
So you mentioned they fill out a form. Now they could be an individual or they could be a police. Okay,
Anybody who's present at the time.
okay. But these people obviously are aware of it, a form. And this is a form that I assume you provide when you distribute the Narcan?
When we distribute the Narcan, they get that information, and yes, they get, not at our pop-ups, we don't provide the forms at the pop-ups. We provide the information that they need to contact us, and we'll help them with the form, which is for citizens is better. The police have the forms, and the police do submit the reform. the
And
forms.
fire as well?
Fire kind of has their own database also.
Okay.
But I work really effectively right now with the fire, and we're developing
Yeah.
kind of those systems there's a group of us that meet every other week. The fire chief has started in Joliet. It's a care group. It's all the kind of care providers that are involved in crisis care. And so we're able to do immediate response. When you find a client who has some issues, we have multiple things they need to take care of. All of the providers are at the table and we can do that. And so that's the kind of work that you'll see informally, more so than formal databases.
Are we giving hospitals Narcan?
No.
Okay, okay.
One, they wouldn't take it because it's a medication and they have rules about how they do their medications. We have in the past asked them to be able to send overdose patients home with it and they've refused. So our hospitals and our emergency rooms in Will County, we have a lot of work to do.
Yeah,
Yeah.
just two more questions. One is a follow-up to that. I know we didn't have warm handoffs at many hospitals. Is the situation the same?
Yes.
Okay. So maybe that's something we
That's
can
part of working
take a
with the
look at
hospitals.
and kind of review at a future date because that is pretty critical. And then for the report you've provided with to us here on the overdose reversals and the overdose deaths, I'm curious about the reversals or the overdose deaths. Do you know if any of those deaths, or do you have the ability to track this data? Did they receive Narcan and it was unsuccessful? Or did they just get no treatment? Do you have that data?
Well, so the coroner wouldn't report that data because they're reporting the cause of death, right? So
Is
uh,
it because she won't or?
no,
could
no,
she-
it's never
could
because she won't.
Could she
Well-
report that?
in reality, the way that's done in some communities is they have a committee that does post-death analysis to try and figure out what contributed to the issue. We are in the early stages of talking about that. The thing is, I don't know that giving someone Narcan stops a death. It stops a death on the site, but contributing to the death of the individual overall, I don't know that the coroner would consider that part of what they report.
I believe it's important, though, to at least be able to understand that. I think our coroner should provide us with that information. And one of the reasons why is because so many people think that Narcan, as long as they have it, it'll save their lives. And that has its own impact. It has a behavioral impact and a mental perspective. So I would like to see that data. I'd like that to come to our committee every month. It wouldn't
He
be,
doesn't have that data.
She-
The people who have that data are the ambulance and the police and the people
no,
who
but I mean,
responded at the
she's able
scene.
to determine what's in that person's system.
I don't know
right?
if she does a tox report for Narcan.
I would
Yeah.
assume.
Can I clarify something
Yeah.
else too? Narcan is not an enabling drug. It doesn't encourage people to use because they know they're going to get saved. That's a false assumption. And the research shows that, and it's no safety zone for anybody. In fact, we teach people to always have someone with you because if you use, you cannot give Narcan to yourself. So people don't use and then not worry about whether they're going to overdose. Nobody thinks they're going to
Well, I
overdose.
actually know people who believe that.
Well, they might believe
So,
that, but it's,
I just, there's a lot of different perspectives, and I think we have to just
So-
put ourselves out there and just kind of know some of the conversations that's happening out there.
Thank
I mean-
thank you, Julie. I agree. I think some more, a better coordination of the information. I think you would want that too. We all
Yes.
do. So I think that's a good point you just made. So,
Mm.
I know that, we're already running late, so I just.
No, I'm sorry.
I just wanted to clarify one thing that, was brought up earlier, just because I have a question and then if there's no other questions, I'll let you go. For the Tinium, what is that?
the RT, whatever, yeah,
770?
yeah, yeah.
Is that Januvin 770. Is that, are we learning about that because it's a replacement for fentanyl, or is it just a filler? Like,
It's a filler.
so
It's in the,
not
it's
gonna
in
be
the drug
new
stream.
thing that
No,
kills people? Okay, I just wanted to clarify.
no, it's in the
that.
drug stream.
Like, there's all of a sudden there's something else.
No, and we report it because if we see it on the coast, usually it's the East Coast or the West Coast. And so the information that I get always keeps us kind of up to date. So we know what to look for in our stream, but we're good.
Gotcha.
We're okay. Yeah. we're
Just
okay.
another filler. That's what we do. We put filler in everything now, just to make it go
Yes.
further. Okay, are there any other questions? All right, well, thank you very much. We appreciate everything that you do.
Thank you.
Mhm. Okay, next we have Elizabeth Bellotta from Health Department. And she has quite a few things to go over with us.
Hi,
Good morning.
happy holidays and happy new year. As you know, I just wanted to explain my report because some of you are new.
I'm sorry,
Oh, I'm so sorry.
I'm sorry, just what's, I was supposed to do something and I got sidetracked. We're having some IT problems right now, so we have audio, but there is no video, but IT's on it and they'll have it fixed. Floor is, yes. So you can all just, no, but I'm
right.
sorry to interrupt you. Go ahead.
No, no worries. So I'm Elizabeth. I'm the Executive Director of the Will County Health Department. Thank you for having me. As you know, Dr. Burke also represents behavioral health at the Health Department. So my report is sort of a plethora of all the different departments. So I have brought with me, and this is what I typically try to do, is the division directors for the other departments so that they can answer any additional questions that you might have. Because as you'll see in my report, it covers health equity, it covers emergency preparedness, family health services, environmental health. It also covers community health center and WIC. So I have brought with me Robert Dutton, who is Dr. Dutton. He is our health equity manager. So if you have any additional questions regarding his health equity report and all the different outreach and agencies that we've been working with. I've also invited Cheryl Picard, who is the Assistant Division Director of Family Health Services. Her division covers all these outreach, tobacco, AOK, WIC. And then I also have Sean Connors, who is the Division Director of Environmental Health here today too. So he can answer any questions you might have. It is Radon Awareness Month in January. So there's a lot of different things in our report. And then of course, Dr. Burke is here from Behavioral Health. So I just wanted to, be here and let you know who I'm bringing so that they can answer any additional questions you might have. One of the big things that the health department is working on right now is our strategic plan. So we will be presenting to our Board of Health in January, our strategic plan, which is the plan for the next 5 years. So after the Board of Health takes a look at that and approves that, I would like to include some of that information in my next report at your next committee meeting so we can provide you with our strategic goals. Sorry, I was just, other than that, there's so much in my report. I wasn't sure where to start, but I do have the individuals here that could answer any additional questions you might have. Okay.
Did you want to let her talk or you just wanted to ask questions?
Oh, no, I am just here to be to introduce my staff and to bring them forward if you have any
Okay.
questions.
Well,
Yes.
Mike has a few questions.
Okay.
Excellent.
Yes, I did. For the Family Health Services Report Survey for the Well Woman community, is it on your website, your Facebook? How can we get you to help share this? Because I would very much like to surpass your number of 200 responses.
This is Cheryl Picard. She's our Assistant Division Director for Family Health Services.
Hello. So they're located in a couple of different areas. So I do think on our website, we do have the QR code. So there's QR codes. We also do have some postcards that we do, bring out to especially any of the local events or any of our outreach type activities.
So is it like on your Facebook too, so we can just share it?
Yes. Mm-hmm.
Because you're wanting to have 200. When is the close date for the survey?
I think we're hoping to get everything wrapped up as quickly as possible here, only because, so MAP, which is what you were referring to before, and I have to go back because it's not an acronym that rolls off of my,
For MAP?
it's, yeah, which is,
Mobilizing, I'm going to work with
yes.
you. I got it.
Yeah, we were just
Mobilizing action projects and partnerships. Am I pointing?
It's close. I know. We all just know it as MAP. But so, especially with a lot of that information, that's what we, help to use then for, MAP. And so, MAP is going to be wrapping up, their reports, they're putting together their data and,
Right.
assessments so that then they can develop then that plan and, put it out. So I do think it's, one of those we're trying to get everything in as quickly as possible. Our biggest challenge is the Spanish speaking population. So as you saw in the report, there's only 2 that we've
Right.
received so far.
We've only
So-
received 178. So I really
Exactly.
would like to get that number up.
Right. Mm-hmm.
So that was all. I just wanted to know how we could get this information and this survey out, so maybe we can get more input. Because the more
Mm-hmm. Yeah.
input we have, the better we can be.
Absolutely. So yeah, social media is probably going to be one of the biggest, ways that we can do that. So.
Thank you.
Mhm. Okay.
And then the other question I had, I don't know who it's for, is the All Our Kids Network. Is that you too? I would just like more information on that.
Oh, yeah. So, so that it's actually, it's a program that we've actually had for, quite some time, with the health department. There are, really even throughout the country, there are, other All Our Kids Network, chapters, throughout. One of the big parts of it is, the IRIS. So that's the referral systems that are going into it. So, so what that does is there's, it's, again, web-based where, if people are looking for any services, if their providers, have someone that comes in and, they think that their clients would benefit, from, services, then they're able to reach out to then a list of people who have chosen to be part of the system, the referral system. And then they, are able to then, reach back out then to the clients,
Wonderful.
that way
I
then as well.
saw that it was about like preschool and
Right.
daycare, and I
Mhm.
assumed you had a list. I know that some of our opioid money is, if I'm correct, it was opioid money. There's been so many different some of that goes to
Mhm.
help with some of that.
Right.
So
And All Our Kids is basically is birth to 3 is what we really focus on, because those first 3 years are the most crucial, just to brain development, to
To
social
socialization.
development. Right. And so, so there's school districts that, are involved. So again, it's, based on who would like to join. So we have, anyone from the community that feels like, they would benefit, from that by, getting both their services out there and, having, a platform to at least say, hey, this is what we've got to offer for you. Also then, bringing forward then other, services that we know just within All Our Kids. So like I say, the school districts, the libraries, there's childcare resource and referrals, part of, that too. So it's just a large group and ever changing. It's very, very fluid. So we've got people that are joining almost, monthly. We've got new people coming in.
wonderful.
Yeah.
Thank you.
Mhm. Okay.
Glad you were here.
So in the past, I have presented the reports where it covers a lot of the other programs that our health department does serve. So in the future, if you would like, which I would like, is I could have one highlighted every month, and you'd still get the written report going over a lot of the other programs, but we could have one that we could highlight each month, if that would be acceptable. I don't know. That's why I wasn't sure how you would like to do it. Typically, my report gets quite long because we have so many programs at the health department. And so if we could highlight one, like environmental health or behavioral health has Dr. Burke.
I'm glad you hit on
EPNR
that one
or-
first, because that's one that I am very concerned about and I wanted to look into. So I was gonna kind of map out this coming year based on some conversations that I had with the people from the different departments and stuff like that. So, but rather than having you do the whole thing and just, highlighting one area, I think that's a good idea.
Okay, no, that would be
And
great.
then I'd just like to talk to you about it and maybe we can figure out how, which one would be next. And
Yes, a schedule of
obviously I'm gonna have some
speakers.
matters that I would like addressed and some questions I have, so you'll be properly prepared when you come in for them.
No, that would work out great. I know that we can get together and we can set out a schedule. So then every month we can bring one of the divisions in to give you a more thorough explanation of all the programs that they have. So that would be great.
Yeah, I was gonna say, when I was chair, and this is our new chair, we had talked about a possible field trip
Oh,
for the new, for the new board. I don't know where that stands. That would be up to, Chair Butler. But, it also gets everybody into the health department, and I think that would help as well.
we
So,
would love to have a meeting or even just a visit, and we could show you our environmental lab, our community health center, and our, at least our 501 Ella building.
Well, I don't know how that works for past new business, but we could always take a vote, see if everybody wants to go on a field trip. Is it acceptable? It's a little out of our, it's not on our agenda, but I don't know if taking a field trip has to be something that gets approved on the agenda.
I think that's probably something we can just coordinate.
Yeah.
administratively. We can-
Just to, everybody up for that?
Right, yeah, right.
Mhm. That would be
It's
great.
probably Your discretion.
Can you have a meeting like where you don't,
You're providing-
then you'd have to make sure that you had like,
staff comes.
okay, well, we'll talk about that. So it sounds like
Yes,
everybody's
thank
up
you
for that.
the Room where we have our board meetings, so
Awesome.
you're welcome.
Okay.
All right.
Oh, sorry.
No, but we discussed it. I was just about to say all that.
Julie?
you, and
Julie,
Happy
got
New Year.
anything? No questions, Julie? Okay.
Thank you. Happy New
All
Year.
right, thank you very much. And now from Sunny Hill Nursery, Maggie McDowell, who I always love listening to. I love that Irish, it's got a musical tone to it. That's putting pressure on you, but,
Good morning, everybody.
oh, hang on, let me see here. You click on the button.
Red yet. Now
There you
I'm
go.
red. Good morning, everybody. Happy New Year. I didn't submit a formal report, but one of the things that I did want to kind of just touch on with everybody, because of course, we're in flu season. Well, looking at kind of what's circulating, there is a whole plethora in terms of infection control issues that are kind of out there in the community. And when we have widespread activity in the community, guess what? In our setting, we end up having to deal with it. So I had asked my infection preventionist to pull the percentages in terms of where we were at vaccination wise for the regular flu, which is your influenza A and influenza B, in terms of where our residents are at. And, currently we're looking at about 150 residents. 85% of the residents are currently vaccinated, which is really good. Those percentages are good. In terms of where we're at with our COVID vaccinations, 58% are fully vaccinated. And we're also talking about the regular flu, we're talking about COVID-19, we're talking about RSV, and we're also talking about pneumonia. And now more currently, we have norovirus circulating, quite active in the community, not necessarily in our community, but I'm talking in general. RSV vaccinations is at 85%, which is very good. And then, of course, our pneumococcal pneumonia vaccinations is at 78%. So all of our vaccination percentages are really good for our population. Currently, we are considered in outbreak status for COVID-19 based on the new definitions as of what day? I'm so mixed up with the holidays. Today is Thursday, Tuesday. We went into outbreak status because we have 3 residents that are COVID positive. And then we have 1 resident that has norovirus. That person has recovered. Norovirus symptoms tend to be very active, nausea, vomiting, diarrhea for about 24 to 48 hours. And this occurred back around December 7th. That person recovered. We were waiting for the onslaught from that because typically when you have norovirus, you don't have it with just one person. It's viral and it's respiratory and it spreads very quickly. Touch wood, we had 1 individual. We have been in constant communication with the health department, with their communicable diseases person, Tara Ide, and working collaboratively with the health department. So as of right now, everything seems very well contained. We have implemented, obviously, precautionary measures. When somebody has COVID, they're placed on precautions. The staff have reverted. In fact, I sent out an ACM, which is an automated care message, to all our families and to all our staff to notify them that effective New Year's Day yesterday, we were going to go back to wearing masks again. We just need to, because there's so much activity going on in the outside community, and visitors coming in. Our staff go home every day, they come back every day, so the exposure is pretty extensive. So we're trying to take as many precautions as possible and put those interventions in place early. So we are masking, obviously hand washing. We do a lot of education with our families too. We are curtailing, not visitation per se, but making sure that people cover their cough, that they don't come into the facility if they have any active symptoms. We just have to be as careful as possible because we have a very vulnerable population. And these are viruses that spread very quickly. The other thing I just wanted to share is Sunny Hill is in our survey window, which means we are open for Illinois Department of Public Health to come in and do their annual health and life safety surveys. Our survey window opened on November the 1st and will run through May 31st. Our survey last year occurred in February, so IDPH will not visit us in February because it's an unannounced impromptu survey where the surveyors come in and survey all our activities for, it's either a Monday through Thursday team that comes in of about 5 or 6 surveyors, or a Tuesday through Friday survey. And we never know when that's going to occur. So pretty much every day can be a survey day. We are working currently on revalidating our Medicare and Medicaid processes, and both of those revalidations are coming up in February. So our finance department is actively working on that right now. And then the only other thing I want to share is, and I've sent out a notification on this, is our annual governing advisory board meeting. This is a prerequisite for the requirements of participation for us to continue to participate in Medicare or Medicaid services, where we have to present to the governing board, which is obviously the county executive and some of the members of this particular board. So I have sent an email to those participants and requesting them to attend. That will occur on January the 27th in the county boardroom, and that will occur from 10 to noon on that date. So I have sent a specific invite to certain individuals, but certainly anyone that's available on that date is welcome to attend, and that's where Sunny Hill will present an overall kind of review of the last year of all our processes that have occurred at Sunny Hill, including our health and life safety surveys.
Well, thank you. I do have a couple, do you have a couple questions too? I'm gonna go first, okay?
You should, I just thought,
I would just urge you to see the congressional oversight report on the handling of COVID that went out last week. You might be interested to, to find out a few facts about masking and stuff like that. The other thing is, for your ventilation systems, do you have UV light treatments inside them?
No, we do not. When we have COVID, we have the special equipment that we purchased that we have a full-time infection preventionist, and she oversees all the processes in terms of implementing like the different measures. And we do EBP, which is enhanced barrier precautions for our residents, as well as isolation in COVID positive cases.
So I would, like for maybe you could look into that, because I know that the ultraviolet lights, the C spectrum that they use in these ventilating systems is good for killing viruses, bacteria, molds. So it could be pretty helpful.
That's something I would have to collaborate with our HVAC, with our facilities maintenance on, so that we have periodically looked at that, and they've done a full evaluation, and our system is very efficient based on the information and the reports that I'm getting back.
Some of the other uses is I know that they can have, they're just the standalone UV lights that they could put in a room when everybody exits a room, because the C spectrum is not healthy to be around for an hour, but it takes about 45 minutes to kill the germs.
Okay.
So it's also something that can help, because when you wash down the floor and a tabletop, it doesn't get everything.
Sure.
So if you could put that in a room, like at night, when the patients are in their rooms, maybe community rooms and stuff like that, to help slow it down. But one of the things in the Congressional Oversight Committee's report was that there was no evidence, and I'm sorry to have to say this, but there was no evidence that masking slowed or prevented the transmission of COVID. So just read it, and then you can take it from there.
Yeah, absolutely.
did
And
you-
I'll share it with our infection preventionist as well, because and our infection prevention committee.
Thank you. Micah?
Yeah, I have a couple questions. I don't know where to start. First of all, I'll start with a positive. I really like the staff connections with the residents' rights. That was very detailed, really good stuff. But then I got to the sections where you're over budget and under budget, and is all of that due to the delay of the 45, is it 45-day window of delay on payments? Or do we have reason to be concerned?
There's always going to be a delay. There's always going to be that time lapse between when we get our payments into finance, and they're constantly kind of working retrospectively to kind of bring that up to date.
So do we anticipate all those balancing out?
I will have to sit down with my director of finance, because right now she's just kind of tying out like all the end of year stuff to kind of see more specifically, okay, what if is everything kind of 100% kind of up to date, or are we still like 45 days out? So that I can have, and I won't know that until another month or so, because she'll be doing all her Medicare and Medicaid cost reporting at that point.
Yeah,
And she's working with the accountant right now to kind of get all of that end of year stuff balanced
Well,
out.
it's crazy, and I don't think that you should have to wait that long, but
Unfortunately,
That's
yeah,
how
by
it
the time a
works.
lot of this stuff kind of trickles in, and then she gets it, but then once she has an opportunity to work with the accountant to kind of figure out, okay, where exactly we are, it's usually around February time. That's when our cost reporting is actually due.
and on a side note, I would like an invite, just a reminder or something to come to the annual report. I've made it for the last 2 or 3 years, and I would
Sure.
love to be there again.
Yes, I'll send out an Outlook invite. I sent an email specifically explaining what it was. I think Charles, you got it, and a couple of other people. But if you would like to be there, I'll add your
Very
name and I'll
informative.
send an Outlook invite.
And then you had a staffing breakdown. You said you have temporary staff is only the 2 interns?
Yes, we have 2 social work interns right now.
And where did they come from? I mean, which,
I believe one is from St. Francis and one is from Lewis University.
so we have St.
And that's something
Francis.
new that we've started doing in the last couple of years. But again, that's because our social workers are very vested in training and in giving back and, giving people that opportunity. So yeah, we usually only have one, but we actually have 2 currently.
So based on the report, it sounded like we are doing really well with the staffing.
Yes, our staffing has gone up significantly. I can't give you an exact percentage. But again, from, COVID, when it took its toll to where we are currently, I mean, we went from probably 160 staff to we're at 210 right now.
So are we still using the contracted?
We will always be using contracted staffing.
Okay.
We have to consider that our staff have an abundance of benefit time that are at their, that's available to them, as it should be. And because we have staff that have such longevity, they've worked up to getting their 5 weeks, plus 2 weeks of, holidays. That's 7 weeks of vacation. So, and we have staff that are 35 years plus. So when you have the staff that have a lot of longevity, yeah, in order, because we're 24/7 service, we're going to end up invariably continuing to have to use agency to cover those holes.
That
We
was-
prefer not to, but it's inevitable. Even if we increased our staffing more, we're still, because those people have to have their vacation and their benefit time.
Yeah, that's what I was thinking, is if
Yeah.
we increase, because I know contractually they're super expensive. They come in for a couple hours, they're traveling care, whatever.
And we're fortunate because we have always had to use agency for the reasons that I've just outlined. We have established, relationships with some of the agencies. So in essence, some of those people that come in so frequently are almost like our own staff, except they're contracted because they're frequent flyers. They come to us all the time. They know our building really well. They know our residents really well. And at the end of the day, they help contribute to that consistent care assignments, because they do come fairly often.
Thank you.
Thank you very much.
Okay, thanks, everybody. Happy New Year again. Oh,
I'm
you have a
sorry.
question?
I'm staff is usually here, so I didn't actually look for a speaker. I apologize. Let's see. There you go.
Thank you. Hi, I'm Kelly Hickey. I'm one of the new board members.
Hi, Kelly. Good morning.
Nice to meet you.
Nice to meet you too.
I had some questions about norovirus. First of all, congratulations for maintaining that, because from what I understand, there's a very small amount of the virus causes an infection, so it's much more contagious than
Very
other things.
contagious.
Yeah.
Yeah. And it spreads, like I said, that's why we are holding our breath, because we're like just waiting for the onslaught, because like I said, it doesn't occur in individual cases. It's usually major outbreak and clusters. Yeah.
And those outbreaks aren't reported to the health department, right?
Yes, they are reported. Yes.
are,
Oh,
okay.
yes, they're absolutely reportable. And we in fact have to submit a daily report in terms of new developments, any new cases, any ones that we're concerned about. Our infection preventionist works very closely with the health department, but
Okay.
any of those kind of public health issues have to be reported, and they have to be reported promptly within 24 hours.
Okay. Is there a change in the cleaning protocol or anything when you have a patient with norovirus?
Obviously, the in-servicing and the education and the reminders to staff, because we're healthcare, it's kind of a standard that you have to maintain.
Sure.
However, you constantly need to remind people about the basics, about hand washing and about wiping surfaces down, because people get they get lax when everything is kind of copacetic. And then when you have an outbreak, it's like, oh, okay, we need to be more vigilant. We need to, wear the masks, because again, covering your cough, and if people, are coughing, need to make sure that we're doing it appropriately, and taking all those obvious kind of measures that we can to curtail the potential spread. Because in our environment, it does spread very quickly. And we use, our PPE, which is our personal protective equipment, and everybody obviously is in service on how to do that. And then people will wear their N95 masks, which they need to when they're in a residence room, COVID positive resident.
Yeah, I'm just very fascinated with this specific outbreak because I've been reading a lot about it recently, just in the general population. And I know that you take care of a very vulnerable population and with people with complicated health histories who
Yeah.
might be on medications where this could be life threatening. It's not just in,
Very much so. And it's one of those that there isn't a medication you can get. You can treat the symptoms. You know, it's self-limiting. You kind of have to let it run its course. And you're kind of dealing with the, you know, the nausea, vomiting, the discomfort, the dehydration, potentially doing labs on residents to make sure that they're not, you know, becoming dehydrated. Maybe they need IV fluids. Those are all the things that we continue to monitor. It's not like there's a magic medication that you can give somebody in those circumstances. So with an elderly, vulnerable population, it does tend to take its toll. You imagine how you feel yourself when you have nausea, vomiting, and diarrhea, and it's very uncomfortable.
And that leads me to one other question I had is, are you being affected by any of the shortages with regards to IV fluids?
No, we've not had any issues. We have a contract with a pharmacy, and we've not encountered any problems in that regard.
Good.
Yeah.
Thank you very
Okay,
much. I
you're
appreciate it.
welcome. Nice meeting you. Any other questions?
Thank,
Okay, thank you.
thank you very much. Okay, so do we have any public comment? Any, oh, would you like to come up? State your name. Let's see. You have to hit the button for me.
The person. Yes.
Okay, you're ready.
Hello, good to see you all. Thanks for having me. My name is Lauren Herrera, and I have a petition with me today. I have currently 369 signatures, hoping to get more. But I was hoping to just read the petition. If that's okay. Thank you. Okay, so let me start. Okay, so dear City Council members and Planning Commission, I am writing this appeal not only as an individual, but as a single mother and fully qualified counselor, deeply connected to the divine source and committed to social justice. Like many others, I am currently without permanent housing. This personal challenge has only highlighted the urgent need for solutions to the housing insecurity many of us face. It is with this in mind that I advocate for the adoption of tiny homes, fully compliant with an updated zoning code as a practical and compassionate solution. Tiny homes, while modest in square footage, provide full functionality and offer a viable response to our community's housing crisis. These dwellings have the potential to alleviate the strain on our housing market, provide affordable, sustainable, and environmentally friendly living options. I urge the City Council and Planning Commission to consider revising the zoning code to allow for the construction and legal occupancy of tiny homes in our area. By amending the zoning regulations, we can create a safe and accessible path for individuals and families who are struggling with housing insecurity. Tiny homes have been successfully implemented in numerous communities across the country, offering not only shelter, but also fostering stronger, more resilient neighborhoods. I believe this can be replicated in our community, helping those in need while supporting a more sustainable and inclusive future. Tiny homes can be classified as accessory dwelling units, ADUs, and special use permits could allow them to serve as primary residences. This approach supports simple, mindful living while addressing the ongoing housing shortage and providing homeowners with cost-effective and flexible alternatives. I respectfully ask for your support in making tiny homes a legal and viable housing option in Will County, Illinois. Everyone deserves a safe and stable place to call home, and tiny homes can be a part of that solution. Together, we can turn this vision into a reality for our community. Sincerely, Lauren Densman Herrera. Thank you.
Thank you very much. So at public comment, we don't have a lot of back and forth. If anyone wants to comment back, they can say something during their announcements by well, I guess we don't have that.
Okay, so that's it.
We can talk with you after.
Okay,
Yeah.
Okay,
Yeah.
thank you. Okay, yeah, thank you so much.
Okay. Was there any other public comment? And then online, nobody? All right, well, I think that does that. And so reports by chair. Well, I was not prepared for this, but you did mention a tiny home, which I am a follower of tiny homes on Facebook. I actually am kind of an efficiency expert, so I really appreciate the tiny home. Like when I build homes, and sometimes I'll be maybe a self-proclaimed efficiency expert, but efficiency in space. So some of the things that I love to do is design rooms and different areas for people who have odd spaces or small spaces. So I can really appreciate those. I love watching them. I love the ones that are set in the mountains and, just completely built into nature. That was my spontaneous comment. Okay. No need for executive session? Well, I guess you could make an announcement. Is that? I don't know, like on the other one, you had comments by committee and by the chairs.
I can take a look into that. Was there an elimination?
No, we just.
Just the way it was written when we're in the bigger group with just the whole board, you have every person can say something plus the leaders. And here it just says the chair.
Open up to you and your preference.
Okay, yes, if you like to make an announcement, yes, we will get Julie's first.
I just wanted to note that the county board has approved ADUs and our resolution was maybe five years ago. It was a while ago and I can't remember when, Chuck. But we did. We have approved, it's was adopted. We do have that ability in Will County. Yeah. And I'm not sure, but as well as that, we also approved the housing with the, it's flying, with the trailers, what did they call those again? It's on the tip of my tongue and I can't, but where they create the housing from the, yes, yeah. So it's all been covered.
Thank you. I think I'd like to encourage the public to, on the matter of tiny homes, to bring this forward to Land Use Committee too. I think that's going to be, a useful information and discussion for that committee as well. I do want to just make an announcement that today, January 2nd, the Community Mental Health Board grant applications have opened up today. It is available on the website, which I've shared with Chuck and Chairman Butler. And if we could please distribute that to other county board members so that they can get that out into their networks. The application cycle closes on February 14th. On January 7th, this is, I guess, a week from now, there's also technical assistance available in a hybrid fashion, both in person and virtually for any applicants. In fact, we've got our executive director for the Community Mental Health Board, Tina Mackey, here. So if after the meeting, any board members have any questions, please feel free to reach out to me or to Ms. Mackey. Thank you.
Right, thank you. Okay, no need for executive session. Okay. Can I get a motion to adjourn?
Motion, Dean Schlatten.
All in favor?
Aye.
Okay, this meeting is adjourned. Next meeting is scheduled for February 6th.
Do you need to get that since she mentioned she has a petition?